My name is Lindy Payne. I work as a registered nurse for hospice. When I came to Synergy, I initially came with right-sided SI joint issues that would radiate down to the back of my leg, down to my knee, sometimes would radiate up to my flank area. The biggest issue was the constant pain waking me up, interrupted sleep, inability to sit for probably longer than 30 minutes at a time without having to really get up and move around. Lots of sharp shooting pains, and there was definite improvement after probably the first couple of visits. But I would say overall, there's definitely been significant improvement. My pain's probably, I still have pain, but it is nothing like what it was when I first came in. It's probably at a 3. I definitely have periods without any pain. It's definitely a lot more tolerable than it was, and it was really nice to be able to do something as minimally invasive as therapy. No major surgeries, no major invasive procedures to accomplish this. So, being a hospice nurse, I certainly deal with a lot of chronic pain issues with patients, and patients that have chronic pain that aren't even related to the diagnosis that we sign them up for hospice for. So having personal experience with pain and taking care of people that experience pain, I can definitely appreciate the situation. So, just anybody that's dealing with chronic pain, whether it is just beginning or whether you've had multiple surgical procedures, I would still recommend coming here. There's only so much that surgery can do. You've still got to improve your overall situation, and it definitely gets done coming here. It's not just about going through the motions and doing the exercises. It's a relationship that you build. It's a rapport. It's overall spiritual well-being as much as it is the physical well-being.